mentioned hormonal imbalances. So we do see a lot of that at HUM2N kind of in our general kind of clients coming to us for health optimization, functional medicine, and thyroid dysfunction as well. And in kind of the conventional practice, they do recognize that thyroid dysfunction is a common cause for infertility, and most fertility clinics are now offering thyroxine if the TSH is not optimal, because the optimal range for fertility and pregnancy is much lower than a conventional normal range. But from my kind of personal experience of having a thyroid problem myself and also treating lots of patients with thyroid disorders, is that it's just, there's so much more than just the TSH, right?
Absolutely.
You know, we have to look at the full thyroid panel, we have to look at the T4 and the T3 markers, and how well is that T4 to T3 conversion happening as well, because 80% of the thyroid hormone that's produced by our thyroid gland is actually T4, but what our body and what our cells need is actually predominantly T3, and we need that effective T4 to T3 conversion to take place. So if you're just kind of lowering a TSH value, that might not necessarily improve fertility outcomes, because you need that optimal ratio of T4 to T3. And I think that's what, again, really fantastic, because as part of a fertility program or a health optimization program, we'll do a complete thyroid panel, look at all the hormone markers, look at all the other organs and test them properly on a blood test. So what are ways that women can maybe support optimize thyroid function and support hormones more naturally or holistically through functional nutrition?
Yeah, I mean, I think that's a really good point, firstly. And also we want to look at the thyroid antibodies, because they might have Hashimoto's, I mean, I might not know about it, or maybe even slightly subclinical Hashimoto's with raised antibodies. We want to be looking at that. And I think another reason why it's so important is because during the first trimester, the baby can't make any of its own thyroid hormone, so it's stealing the mother's hormones. So if you've got even a slightly sort of subclinical underactive thyroid, there's going to be an issue. And actually we see that as being quite a key cause of miscarriage in the first trimester, so very important. But in terms of supporting your thyroid health, so the thyroid's all about metabolism. So I think all these things we can do from a dietary perspective, lifestyle perspective to support our thyroid hormones, the better. So for example, from a diet, we are looking for a really broad diet. So not a restrictive diet. Eating the rainbow, eating really good quality sources of fats, proteins, carbohydrates. So just coming back down to the basics really, but then also thinking about some specific nutrients that are great for supporting the thyroid. So things like selenium, which you can find in Brazil nuts, just 3 Brazil nuts a day. That's a really easy one that anyone can take on today. And even iodine as well, so seaweed, seafood, that can be really wonderful. So you really want to be thinking, especially if you're on a vegan, vegetarian diet, how can you make sure you're still getting in some of these nutrients that are really supportive of thyroid health as well. And I also like to think about how the thyroid links to our stress hormones and also our reproductive hormones as well, because they're all influencing one another. And if you tend to see something a bit off on the thyroid side of things, you need to be looking at the adrenal side of things, the sex hormone side of things as well, because there'll normally be something off there. So, for example, stress management has to be a really key part of the protocol, which is the last thing anyone wants to hear, because everyone's already so stressed on a fertility journey. But also, on the sex hormone side of things, all sex hormones are made of cholesterol. So it's something we've been told to avoid for the past few decades. But actually, we need cholesterol. All our sex hormones come from that. So what's the fat content like in your diet? Have you got healthy fats in the diet? So we'll be taking a really holistic approach to really support the thyroid. And if there are any raised antibodies as well, we really need to be thinking about whether cutting out gluten for a period of time might be helpful to bring that down, or maybe any of the other sort of common allergens as well.